Hello, my name is Hayder Saeed. I'm an associate member at Moffitt Cancer Center, attending American Society of Hematology meeting here in San Diego, California for 2024. I would like to discuss with you my published study about the use of oral azacitdine with oral Duvelisib in patients with T-cell lymphoma. So this is a phase 1 study addressing an unmet need in patients with relapsed T-cell lymphoma. This is a rare group of patients. However, they don't have really any effective treatment options that are currently available, so we need a good option for them to help control their disease. We have seen some signal of activity with two types of drugs. One is called PI3K inhibitor, Duvelisib, and the other drug is a hypomethylating agent called oral azacitdine. Both of those drugs are currently available and used to treat other types of lymphoma. So we combine them together to see if we can have better activity in T-cell lymphoma. So here we gave both of those drugs together for 2 weeks, and then we gave only one drug continuously afterward. As you can see here that this treatment alternates, so we will have oral azacitdine for 2 weeks on, 2 weeks off, and continuous treatment with Duvelisib. Since this was a phase 1 study, we elected to escalate the dose gradually for Duvelisib while maintaining the dose of oral azacitdine at 100 milligram, and we reached the dose limiting toxicity at cohort 3. We reached the dose limiting toxicity as dose level 3. So the final dose that we selected for phase 2 study and we recommended is Duvelisib 50 milligram given twice daily for the first 2 months or the first 2 cycles, and then the dose will go down to 25 milligram, and the oral azacitdine will be given continuously for 2 weeks on, 2 weeks off throughout the patient treatment. What's interesting in this study is that we didn't see any unusual toxicity signal for this combination. It was the expected transaminitis or the elevated liver enzymes that we see with those drugs. However, the efficacy standpoint, it was very interesting that we see in a subgroup of those patients what we call T follicular helper T-cell lymphoma, which represent around 1/3 of patients with T-cell lymphoma. Out of 4 patients we treated on this regimen who have that phenotype, actually all of them had complete response. So we had 100% complete response. 3 of those patients proceeded to allogeneic stem cell transplant. They were doing okay by the time of publishing this report. And 1 patient was actually in remission for a long time up until he relapsed. He did not want to proceed to allogeneic stem cell transplant. On a cellular level, we see the combination of those drugs work better than each one of them separately, as well as we did not see suppression of the Tregs activity, which are essential types of cell to protect the body from the toxicity of one of those drugs, which is Duvelisib. So it's very interesting data, and we hope that this will develop into a phase 2 study, and we can get more, or we can confirm those efficacy data to the point that we can take this treatment regimen to the clinic.